If you have a blockage or narrowing of an artery around your heart, you may be told you need a balloon angioplasty and a stent placed.
This is called balloon and stenting, and this is a very common procedure that has been done in the entire world millions of times already. So actually the risk is pretty safe.
Most of the times stents do a wonderful job, and patient doesn't have to go through huge surgery.
Stents are common and a lot smaller than you may think.
It is really, really tiny. This is the fingertips, and this is just the metal scaffold that we put into patient.
It's typically a minimally invasive procedure where tubing is inserted into the blocked artery, and let's just let Dr. Chan explain.
This tubing has a special features to it. It has a little sausage-shaped balloon attached to it, so that when it is inflated, it will push the cholesterol, the blockage, up against the wall, opening it up temporarily. But then this is only a short-term solution. To really prevent it from coming back in, we have to deflate that balloon, withdraw the entire tubing, put another tubing across the lesion.
The next piece is the stent itself, which looks a bit like chicken wire.
But then, in addition to the balloon, it has a metal scaffold attached to it, so that when it is inflated and then the balloon is deflated, the metal scaffolds stay behind, keeping the arteries open for a long time.
Patients can have multiple stents, and they are permanent.
Patient can have multiple stents, and they can be overlapping, they can be in the side branches, and even if a patient has a stent and if they decide to have bypass surgery, if their disease progresses, they can still have bypass surgery down the road.
If you have a stent placed, it's typically managed with medication and a few lifestyle modifications and can help prevent a bigger heart surgery down the road.
The stents remain open with the medications and regular follow-ups with the cardiologist, and it reduces the huge burden of surgery for the patient, and the stent just takes is 1 hour at least, and they can go home the next day.
At MercyOne Siouxland Medical Center, Katie Copple reporting.